Thank you. So hi, I'm Caitlin Chandler. I currently work for the International Treatment Preparedness Coalition, but I'm also an advisor to HIV Young Leaders Fund and had the privilege of coordinating a project in 2013 which sought to better understand the sexual and reproductive health needs of adolescents under 18 who sell sex in Asia and the Pacific. So this presentation stems from that research. So we had two goals with our research in Asia. One was to better understand the experience of adolescents under 18 engaged in selling sex and accessing health and other services. We focused on SRH and HIV services, but we were also interested in the full range of services that young people need to access for their well-being. And the second goal was to identify promising programmatic approaches and recommendations for how we can better address adolescents' health and well-being. Most importantly, by listening to adolescents and young people themselves, of which there was very little in the published literature. The methodology for our research consisted first of a literature review and background paper. That paper was actually just released here at the International AIDS Conference, so if you're interested in obtaining a copy, I'm happy to connect you to the folks here from HYLF who can facilitate that. We then organized 14 community consultations using a standardized community consultation methodology in several countries in Asia and the Pacific. These were hosted by community-based organizations that we connected to through partners, such as through Save the Children, local affiliates, and other groups. And these community consultations brought together young people 18 to 24, but young people who had initiated into selling sex under 18 years of age. So as you can imagine, there's different ethical issues with doing research with actual adolescents. In this project, this was the way that we approached it, but definitely more work is needed to listen to the voices and experiences of those under 18. We included young women, young MSM, young transgender people, and young people who use drugs in these community consultations. We then had a regional youth consultation in Bangkok in November 2013, which brought together young people from across the region to make recommendations about how they want their health and rights respected. So what did our research show us? Well, it showed us that there is actually quite a lot that we know about adolescents who sell sex in the Asia-Pacific region. We know that many people do initiate selling sex when they're young, and several studies have shown that a significant percentage of sex workers in different countries began selling sex when they were under 18. Young people under 18 who sell sex have increased vulnerability to SRH and HIV concerns. This is for a variety of reasons, but it can include their biology, that they have a higher number of sexual partners, that they're even less positioned to negotiate condom use than older people who sell sex, and that they're often working in hidden and underground ways, and this makes it very difficult to reach them with SRH and HIV services. And some studies have also found that they may be more likely to use drugs. Yet, despite the fact that young people under 18 are incredibly vulnerable, there's significant policy and legal barriers. This includes that the criminalization of sex work for those over 18 also affects younger people. Often domestic legislation in Asia Pacific also does not reflect international law and policy guidance around involuntary rehabilitation. So unfortunately, many adolescents may go through the criminal justice system instead of receiving the supportive services that they need. Also, mandatory reporting laws often put health care and service providers in a difficult position where they may be mandated by the state to report someone who's seeking services from them, but that can result in consequences such as detention for the young person, so it might not actually be in their best interest. And just to emphasize that our response to young people and to adolescents who sell sex remains in many cases punitive and law enforcement based, rather than looking to provide them with voluntary rights and evidence-based services. So I'm now just going to briefly present what some of the main findings were from the community consultations and the regional youth consultation that we held. The first is that, unfortunately, the way that child protection is being interpreted at the national level is actually creating harm. So this goes back to the fact that many adolescents under 18 who are engaged in selling sex experience abuse and violence through state systems, whether that's if they are put into a detention or jail-like center for their rehabilitation, or when they are interacting with the police. And so one young woman in our India consultation said, "What's the difference between a rescue raid and just being arrested?" The second is that police were actually cited as the #1 concern for adolescents, and this was because the cases of police abuse, violence, and extortion were horrific, and this came out really clearly in every single community consultation. So again, the fact that our response to this group of young people is based around law enforcement is incredibly problematic. In Pakistan, there were some really horrific stories that were shared about police actually raping young men who have sex with men who are selling sex. Adolescents who sell sex cannot access confidential health information and services. This is also due to something that other young people also experience in Asia Pacific, which are parental consent policies. But in addition, adolescents who sell sex face even more blatant stigma and discrimination from healthcare providers. And many of the young people don't even feel comfortable going to seek health services as a result. Another kind of shocking finding that came out in the community consultations was that some adolescents had actually experienced physical abuse from healthcare providers, as well as coerced HIV testing, as was the case in the India consultation. Another thing that our background paper and research documented was that although there is a lot we know, there are also some huge gaps in our HIV response for this group of adolescents. There is almost nothing that's published around treatment-related issues for adolescents under 18 who are selling sex and living with HIV, how to ensure that they are retained into either pre-ART care or how to support them with adherence. There is very little policy guidance for addressing the holistic needs of adolescents under 18 who sell sex, and there is a lack of documentation of program models that could be scaled up that are effective and rights-based. So what do adolescents and young people want? These were the recommendations that came through from our regional youth consultation. They want increased access to funding for peer and other services. So we spent a lot of time at the regional consultation speaking about the survival strategies that adolescents and young people actually use themselves to protect them from police brutality, to protect themselves from other forms of violence, and they have never received funding for those kinds of peer-based services. They would also like access to community mobilization and community organizing opportunities. And they also, of course, said that resources should not just be focused on HIV and SRH, but should also go to the other things that they might need, like safe housing, like access to educational opportunities. The second big recommendation was around improving the quality and accessibility of healthcare services. So again, going back to the fact that so many faced extreme stigma and discrimination, but also in some cases abuse from healthcare providers, that there really needs to be training of healthcare workers around what are the rights of adolescents who sell sex to access health services, and that adolescents need services that can be provided in one place so that they don't have to go to many different places to receive them. And of course, also, again, going back to community-based healthcare services would be especially relevant for this very hard-to-reach group. They also said really clearly that they wanted legal and policy change, that sex work should be decriminalized, that carrying condoms should be legal, and that more programs should address police violence and corruption. They also said that they wanted access to education and job training programs, empowerment programs, tailored education programs that allow them to both try to make a living, but also be working towards increasing their education, and then job skills training and opportunities that pay a decent living wage, which many of the young people we've worked with do not have access to. So just a quick update on since the research took place. A lot of this has informed the IATT on key populations technical brief on young people who sell sex, which has been released at this conference in draft form. The background paper that I mentioned was published here at the AIDS conference, and we also contributed to a Lancet commentary, which is in the Lancet sex work issue that came out at the conference, in which we have articulated, along with Craig McClure and Susan Bissell from UNICEF, what a new approach could look like towards adolescents who sell sex. HYLF is now also undertaking similar community-based research in Africa and Latin America. So I'm really happy to be able to share that they have a health equity for all coordinator, Dennis, and I've included his email here in case any of you would like to get involved in that process that they will be undertaking moving forward. And I just wanted to include a quote from that Lancet commentary that I mentioned, that it is crucial that programs and policies for sexually exploited children and adolescents aged 10 to 17 years who sell sex are not merely based on assumptions. Instead, policymakers, programmers, researchers, and youth organizations should work together to ensure that adolescents are involved at all levels of program and policy design, implementation, and evaluation, so that the response is shaped by their realities, needs, and aspirations. Finally, as I mentioned, the IATT on key populations technical brief is unfortunately still in draft form, and we really want to help get it out there to the world because we think it's an incredible document. So HYLF is joining other youth organizations in pushing to release the briefs. This is the hashtag where you can follow the campaign on Twitter, and there will be a media release about it either later today or tomorrow. And HYLF is also going to be doing an advocacy brief that ties together all of this research so that what young people want is also out there for programmers and policymakers. Thank you.